Hygiene in Nursing. Introduction to the module. This module provides an introduction to hygiene in nursing and how vital it is to protect the well-being of your patients. You will learn how to provide proper hygiene care to patients, the hand hygiene washing process, how to bed bath a patient, and more. Topics to be covered: hygiene, AM and PM care, oral hygiene, hand hygiene for nursing, bed bathing patients. Hygiene. The term hygiene is defined as a practice or condition used to maintain health through the cleanliness of your body and attire, attained through washing, dressing, using the bathroom, and carrying out the laundry. Hygiene is vital in nursing for many reasons. These include: to prevent the spreading of disease, to protect the skin from sores or rashes caused by excretions, to protect oral health, to improve emotional well-being through cleanliness, to decrease the risk of social risks of uncleanliness. Assessing the client for their personal hygiene habits and routines. Many factors influence your client's personal habits and routines of hygiene. They can be the result of cultural background, practices, their mental condition, financial factors, energy levels, or environmental factors such as being homeless. These personal habits and routines will impact your assessment of their hygiene needs. In most societies, it is the norm for people to remain clean due to the culture-based value of cleanliness, but this may not always be the case. Some cultures may lack this common practice, or religions' practices even impact your client's hygiene. Age is also a factor in personal habits and routines. They may lack the cognition to remember to keep clean, or simply be unable to due to mobility restraints or health conditions. Regardless, their hygiene is the highest priority. Assessing and intervening in the client's performance on their daily activities. Assessing the performance of your client's daily living practices will identify any support requirements needed. Some clients will be completely self-caring following assessment, but other clients will require multiple forms of care. They can include: 1. Bathing standards. Bathing is necessary to cleanse the client's body of the sweat, dead skin, and general dirt or build-up on the skin throughout the day. Depending upon the client's condition, they may bath themselves, require partial help, or require what is called a bed bath. This involves washing the patient in their hospital bed or bed at home. 2. Perineal care. This care is usually carried out during a bed bath to check the incontinence pad and genital area of the patient. This ensures the area is clean and no sores are appearing. 3. Shaving. When shaving patients, there is often little risk involved, unless they are on anticoagulant medications which thin the blood. If this is the case, a small cut from a shave could lead to prolonged bleeding and delayed healing. 4. Oral hygiene. To be carried out at least twice daily, oral hygiene involves complete oral care from brushing, flossing, and rinsing the mouth. Additionally, dentures are also cared for in the same manner. 5. Foot care. Washing of the feet is general personal hygiene, but patients with diabetes should receive consistent foot care. This is due to diabetes affecting the feet in multiple detrimental ways, which can lead to infection quickly if the feet are not cared for fully. 6. Hair care. Washing the client's hair with shampoo and with conditioner will ensure the hair is clean and dirt-free. Encouraging the client to brush or comb their hair a couple of times daily is advised. 7. Nail care. This is a further area to ensure is cared for on a daily basis. Keep an eye out for any dirt buildup, fungal infections, nail overgrowth, and ensure the nails are not jagged or sharp. This ensures both staff and the client are not at risk of cutting themselves on the nails. AM care and PM care. The AM care of the patient ensures they are prepared for the day ahead and clean throughout, while PM care covers the period of the night. During each time period, care should be completely delivered and the patient's condition observed fully. AM care. This provision of care in the morning sets up the day ahead for the client and ensures they begin the day clean and refreshed. It can include gently waking them shortly before breakfast is served, helping them to wash, providing an opportunity to use the toilet and all the above. PM care. The night PM care is provided just shortly before the client goes to sleep and ensures they get a comfortable and safe night's sleep. This care includes helping the client prepare for sleep, giving evening medications, helping with oral care and checking vital observation signs. Oral hygiene. Oral hygiene is the complete care of the mouth and the teeth. It can include helping patients carry out the brushing and flossing of their teeth 2 to 3 times daily, encouragement of oral hygiene and special oral hygiene. Special oral hygiene involves caring for and cleaning the mouth of a patient that is dependent or unresponsive, often using sponge applicators doused in water. Some patients require more frequent oral care. They include patients that are being sick, unconscious, undergoing specific medical treatment, on supplied oxygen, suffering from a high temperature, breathing through their mouth, passing away, receiving care via tubes in the mouth and/or nose or tube feeding, assisting the patient to floss and brush teeth. To assist a patient brush and floss their teeth, it is best to follow this procedure. Initial preparations. Gather the equipment required, for example toothbrush, toothpaste, floss, mouthwash, towel, tissues, gloves and a face mask. Raise the patient's head to a sitting position. Lower bedside rails. Cover the patient's table and assemble equipment on it. Cover the patient's gown with the towel. Support patient if they required assistance brushing or flossing. Prepare toothpaste on the toothbrush. Put on gloves and face mask. Brush teeth in a safe and gentle motion starting with the front teeth. Downwards brush the molar teeth. Carefully brush backs of teeth. Gently brush the tongue. Give patient water to rinse and spit out. Figure, brushing the teeth. Carefully floss patient's teeth, wrapping the floss around your middle finger. Provide mouthwash if the patient requires it. Wipe the patient's mouth or provide tissue, so they may do so. Take the towel away. Rinse the toothbrush. Take off gloves and mask. Finish the procedure. Figure, using the floss. Hand hygiene for nursing. Hands will always naturally hold germs and bacteria on them. To ensure patient safety and your own, hand hygiene vital to reducing the risk of infection and the safe provision of care. Not only does hand hygiene involve washing your hands, but also thoroughly drying them afterwards. Hand hygiene process. Using the correct process helps remove as much of the germs on your hands as possible. They are: wet your hands with running water under a tap. Apply soap and rub your palms together thoroughly. Cover back of hands with this lathered soap from your palms. Clean between your fingers. Grip the fingers on each hand. Thoroughly clean the thumbs by gripping and cleaning with opposing hand. Clean fingertips on the palm of opposing hand. Dry hands thoroughly with clean hand towel or tissue. Figure hand hygiene process. When to perform. When your patient has touched your hands, or coughed or sneezed near you. After touching any surface, equipment, objects, etc. in the patient's living space. When handling patient waste such as urine, vomit and feces. You must always wash and dry your hands, perform hand hygiene. Prior to and after coming into contact with a patient. After removing your gloves. You must also perform hand hygiene. Prior to putting on protective equipment and after removing it. Prior to providing food and drinks to the patients. Following the making of a patient's bed. After assisting the patient back from the bathroom. After removing all forms of waste from patient living space. Always perform hand hygiene. As it is best practice to follow these guidelines and instructions for proper hand hygiene, you must also follow this practice for yourself. For example, after disposing of tissue you have used, before you eat, after you use the toilet, before and after work, and after coughing or sneezing into your hands. Bed bathing patients. Bed bathing is a vital aspect of patient care to ensuring their hygiene is always optimal and infection risks are low. It involves washing a patient at their bed or bedside and essentially helping them bath without the use of a bath or shower. General principles of bed bathing. Ensure patient is kept warm throughout. Keep a linen waste nearby to immediately dispose of dirty linen. Expose only the area being washed. If the water becomes dirty, change it. If clothes become dirty, change them. Check for sores caused by pressure. Avoid getting water on dressings or drains. Avoid rubbing the skin dry. Instead, pat it dry to reduce the risk of friction sores. Wash and dry skin folds after separating them to ensure no area is missed. Ensure correct manual handling is used throughout. Even when the patient is unconscious, talk the patient through the process.